Now let's solve the challenging case 150. In this video I presented a fundus video in which you can see inflamed optic disc, gray-white subretinal infiltrates that are spreading centrifugally from the disc in a snake-like pattern. Active lesions are showing leading edge, you can see at the peripheral edges of large vessels. Now these usually resolve with retinal pigment epithelium, choriocapillaris and choroid atrophy. So this fundus is of 30 years old female patient who presented to me with painless decrease of vision in the left eye for the last 4 weeks. Her right fundus was normal and I am showing you her left fundus. There was no history of trauma, infection, any systemic disease. There was no refractive error. Her vision was 6.6 in the right eye and 6.60 partial in the left eye. Pupil of the right eye was reactive and left eye sluggish. IOP was normal in both eyes. When I examined the fundus, I found these lesions centered on the disc and radiating in peripapillary area in a serpentine snake-like pattern. Patient denied any previous episodes, so it's most likely the start of a chronic inflammatory condition called serpiginous choroidopathy, which is usually a bilateral, chronic, progressive, recurrent inflammatory disease of retinal pigment epithelium and choroid. So though it is bilateral, it is often asymmetric with multiple lesions in different stages of resolution. There was a quiet anterior segment and vitreous. Usually it affects middle-aged men mostly, but our patient was female. It is also associated with tuberculosis, so chest X-ray and Manteau test is mandatory to rule out tuberculosis, and then you can start the anti-inflammatory therapy. In this patient, we have a classic serpiginous choroidopathy and there are other forms as well, like macular serpiginous choroidopathy and empygenous chorioretinopathy. In differential diagnosis, you can include other white dot syndromes, including APM, PPE, toxoplasmosis, VKH, other posterior uveitis, tuberculosis, tuberculous uveitis, birdshot. Investigations usually performed are fundus angiography, fluorescein angiography, ICG, indocyanine, and fundus autofluorescence. So after ruling out tuberculosis, start oral steroids in acute stages, like I started oral steroids, and patient usually require the treatment for longer duration. So steroid sparing drugs like azathioprine, methotrexate,